let's get started. My name is Dr. Scott Fromm. I am a dual board certified periodontist. I'm certified by the American Academy of Periodontology, as well as the American Academy of Osseointegration. Nice work. I'm a professor at Stony Brook in the Department of Periodontology, teaching implant complications to the postgraduate periodontal residents. And I maintain a private practice in New York City, New York for the last 15 years. Okay, beautiful. I think the topic of implant failure and cost is a very important one. Implants are a very big investment for both the patient and the dental practice. You're not only investing, money, of course, but you're investing your time and you're investing your skill, and most importantly, you're investing the patient's emotional well-being into the replacement dental prosthesis that you're giving them. So you want to protect that investment. One way you protect that investment, of course, is having follow-up, making sure the patient comes in, making sure they do their hygiene and take care of themselves. Another way you protect your investment is case selection. And of course, the final way you protect your investment is making sure that you're using the right products. Right? You want to make sure that the products you're using are vetted in peer-reviewed journals, as well as performed in the research over a period of time. The protection of the long-term investment is very important because the number one reason why implants fail is usually due to malposition of the implant. By building a strong foundation as well as a wide enough foundation for the proper placement of the implant, what you're doing is you're basically ensuring long-term success or eliminating one of the major reasons why implants fail. So building that foundation, just like building anything in architecture, of course, by building a solid foundation, you're protecting your investment, you're protecting the house. In this case, you're protecting the implant crown. I choose the materials that go in the patient's mouth by simply the golden rule. What would I want to be put in my mouth? And what I want to be put in my mouth if I ever need a dental implant or grafted is material that have been peer-reviewed, have been researched extensively, and has been around for a long period of time. What is going to give me the most long-term stable result that I possibly can get in a patient? I conducted a study with a colleague of mine named Addison Killian on the cost of economic failure. Now, a lot of times in the literature and in magazines we read about, the success rates of dental implants and how they perform over a period of time, but very little do we hear about the actual cost to the dentist if an implant fails. And we looked at the extra time, the extra materials, and of course, the cost of a bad review for the patient. And we added all of that up, looked at the profit margin, looked at what it would cost the dental office for a failure, and then we put a number on it. We kind of accounted for the aggravation the patient would encounter when an implant fails. And that was one of the first studies that ever did that and ever looked at that. So I really think it was an unspoken story that needed to be told. When we say bone is bone, it's really not. And we have to look at the cost that it can cause if it fails, as well as the real severe emotional problems, as well as emotional chaos it can cause in a patient's life. The best advice I have for colleagues to protect investment as well as protect themselves is really know the biology. Know the biology of what you're doing. Just don't know the mechanics, know the biology and know the rationale. Similarly, if you're going to pick an implant or you're going to pick a graft material, make sure you know why you're picking that graft material for the specific purpose, as well as know the research behind it and know how it performs. Not all grafts, not all implants are created equal, and some are good for certain conditions and some are not. So the best advice I would say is make sure you know what you're doing and back it up with a biologic rationale.